My pep talk today is entitled Hospital Management of COVID-19 Patients, an Overview. COVID-19 patients are those infected with COVID-19. They may be symptomatic or asymptomatic. For the symptomatic patients, they may be in mild, moderate, severe, and critical stages. Management of COVID-19 patients may be done at home, at a designated quarantine or isolation facility, or at a hospital, depending on the stage and other situations. As a general rule, COVID-19 patients with moderate, severe, and critical diseases should be managed in a hospital. Asymptomatic and mild COVID-19 patients can be managed at home or at a designated quarantine or isolation facility. My pep talk will focus on the hospital management of COVID-19 patients who are in the moderate, severe, and critical stages of the disease. I will just give an overview of how the patients are being managed in the hospital. The following are indications for admission to a hospital for further management. COVID-19 patients with moderate severity of the disease, which consists of those which are symptomatic with non-severe pneumonia, or those manifesting difficulty of breathing at home, but with a respiratory rate of still less than 30 per minute, and or with oxygen saturation of still more than 92%. In some cases, these moderate COVID-19 patients can be managed at home, but there must be a close monitoring by a physician through telemedicine. Number 2 indication, COVID-19 patients with severe category of severity of the disease, which means these are symptomatic patients with severe pneumonia or those manifesting difficulty of breathing at home with a respiratory rate of more than 30 per minute and with oxygen saturation of less than 92%. The third indication, COVID-19 patients with critical severity of the disease, which means those manifesting respiratory failure, septic shock, and or multiple organ dysfunction. The last indication is COVID-19 patients with mild severity, but with concomitant, uncontrolled, chronic medical conditions or diseases such as diabetes, heart diseases, hypertension, is also an indication for admission to a hospital. In the hospital, differentiating from home care, the COVID-19 patients admitted are given more intensive respiratory support, such as high-flow oxygen and intubation with mechanical ventilation as indicated, more intensive medications for both COVID-19 and existing medical conditions, and more intensive monitoring of symptoms and vital signs with a lot of diagnostic tests such as CT scan and inflammatory markers. At present, there are different, therefore, no universal or uniform protocols in managing COVID-19 patients in hospitals in the Philippines as well as abroad. In the end, the specific management will be dependent on the mindset of the attending physicians, government's approval of the emergency use authorization of drugs against COVID-19, the severity of the COVID-19 infections, and the availability of resources, including financial capability of the patients and relatives. It is to be noted that it is very, very expensive once one is admitted to a hospital for COVID-19 management. In terms of medical management, everything is done on a no guarantee of recovery, best effort basis. Highest mortality rates, which is equivalent to unsuccessful medical management, are seen in those patients with severe and critical stages, and those with comorbidities, or meaning there are concomitant medical diseases, and lastly, elderly patients. Thus, the moral of COVID-19 is to avoid COVID-19 infection at all costs, as once you get infected, you carry a risk of dying from it. Nobody can predict with 100% certainty whether you will recover from the COVID-19 infection or not once you get it. Furthermore, it is very, very expensive to be hospitalized for COVID-19 management. So takeaway in this pep talk: 1, COVID-19 patients with moderate, severe, and critical diseases should be managed in a hospital. 2, compared to home management, hospital management of COVID-19 patients are given more intensive respiratory support, more intensive medications for both COVID-19 and existing medical conditions, and more intensive monitoring of symptoms and vital signs with a lot of diagnostic tests. 3, there are different protocols in hospital management of COVID-19 patients. In the end, the specific management will be dependent on the mindset of the attending physicians, the severity of the COVID-19 infections, government approval of the emergency authorization use of drugs, and the availability of resources, including financial capability of the patients and the relatives. 4th, everything is done on a no guarantee of recovery, best effort basis. And lastly, it is very expensive to be hospitalized for COVID-19 management. The moral of COVID-19 is to avoid COVID-19 infection at all costs, as once you get infected, you carry a risk of dying from it. Nobody can predict with 100% certainty whether you will recover from the COVID-19 infection or not once you get it. The end of my pep talk. Mabuhay